If you are ill, then you need to phone the doctor to make an appointment. The place you phone is called the doctor's surgery, although the word surgery is also the noun for what happens in hospital when you have an operation. If you have surgery in a hospital, then you'll be under anesthetic and asleep while the operation is carried out. Although a doctor's surgery has the same name as the medical procedure that happens in a hospital, no actual surgery normally takes place there. The doctor's surgery is the place that you go to talk to the doctor, and the doctor may look at you, examine you, or give you an examination to see what your medical problem is. If you phone the doctor's surgery, they will ask you what the problem is or whether you need to see a doctor or a nurse. They might say, "What's the matter?" Then they will ask you what your symptoms are. Your symptoms are signs that you have an illness or disease. The signs that you are unwell, sick, ill. If you have a cold, for example, your symptoms will include a bunged up nose, maybe a runny nose, possibly a sore throat, a cough. You might have a headache. If your problem is more serious than a cold, if you have flu, for example, then you could have more serious symptoms such as dizziness or a high temperature. There are other illnesses that you might have, and these illnesses you will have other symptoms. You might, for example, have a problem with your skin. You could have a rash. You could have a raised rash. This means that your skin would be a different color, probably red or pink, or have lumps or spots on it. You might have aches or pains in your body rather than symptoms of a disease you could have caught. You could have backache. You could have pains in your joints. You could have stomachache. You could have cramps. Maybe you don't have an acute illness. Maybe you have a chronic condition instead. An acute illness or an acute condition is something that lasts for a short period, whereas a chronic condition is something that carries on over a long period of time. A chronic condition might be something like arthritis, diabetes, asthma, or high blood pressure. When you phone the doctor's surgery, they will ask you for your symptoms, and they will ask you if it is an emergency. If it is an emergency, they will probably suggest that you phone 999, or that you go to hospital or phone the emergency services so that an ambulance can come and pick you up and take you to the hospital. The ambulance will take you to accident and emergency, which is also known as A&E or casualty. In the USA, this place is known as the emergency room. You would only need to phone the emergency number, in the UK 999, if you had a serious emergency and had to go to hospital immediately. If you have a less serious medical problem, you'll phone the surgery and ask for an appointment. When you are at the surgery, the receptionist might ask you whether you need to see a doctor or a nurse. A nurse deals with things such as birth control or contraception, or clinics for controlling weight, blood pressure, and diet. Nurses might also have clinics when they take blood samples. If you have an illness for which you need to be diagnosed, then you will have to see a doctor. If your problem is not an emergency, the receptionist may ask you whether it's urgent. Urgent doesn't quite mean an emergency, but it does mean that you need to see the doctor very soon, maybe today or tomorrow. If your problem isn't urgent, then you'll have to wait to have an appointment in a few days or a couple of weeks' time. When you go to the doctor's surgery, also known as the doctor's practice or medical practice, then you will have to report to reception and give them your details. If you are registered at the practice, they will not need to know very many details as you will have already given them all of your personal information when you registered with the practice. But if you haven't yet registered, then they will ask you to fill out a form with things like your ID number or passport number, your date of birth, your address, your weight and height, and so on. After you have reported to reception and told them who you are there to see, for example, Dr. Smith, then you'll be asked to wait in the waiting room. When the doctor is ready to see you, you'll be told to go through to see the doctor. In the doctor's room, also known as the consulting room, he or she will examine you and ask you questions such as, do you have any pain? Is it a sharp pain or a dull pain? Have you had any injuries or accidents? Have you had any difficulty sleeping? Are you low on energy? Are you feeling out of sorts? Under the weather? Do you have any swellings or soreness anywhere? The doctor might want to ask you whether you have had any dizziness. They might want to ask you about how going to the toilet is for you. The medical words for going to the toilet are to urinate if it's liquid, or to have a bowel movement if it's solid waste. They might say a number 1 for urination and number 2 for solids. Urine could be called wee. Solids could be called poo. People do or have a wee or a poo or pass urine. What you produce when you do a poo is sometimes called a stool in medical situations. Wee and poo are the words you would use if you were speaking to a young child. If a doctor or nurse wants to ask a woman about her menstruation, then they might refer to menstruation as the period or your time of the month. The doctor is likely to ask you questions about your weight, smoking, drinking, alcohol, and other habits that might have an impact on how healthy or well you are. After the doctor has diagnosed your problem or illness, then they are likely to prescribe you medication. If they provide you with a prescription, it will have instructions as to how to take the medicine, how much to take, and how often to take it. You will take the prescription to a pharmacy or chemist's, and then the pharmacy or chemists will fill the prescription for you. They will supply you with the medication you need. There will be a charge or prescription charge for this medication, an amount of money you'll have to pay in order to get your medication, which in the UK will be the same whether the medication is expensive or not expensive. In other countries, such as the USA, prescriptions will probably work slightly differently, and charges and medical insurance will probably be involved. The medication that is provided might be tablets, pills, or capsules, which are all very similar. Or they might have some ointment that you can apply to the skin, or you could have syrup, a sweet liquid with medicine in it that you drink. Medication and drugs are the same thing, but the word drugs is also used for chemicals which are often illegal, such as cocaine, amphetamines, or ketamine. But we do not use the word medication for these drugs. They are often referred to as recreational drugs or illicit drugs. In the USA, drugs are often referred to as narcotics, though in a medical context, narcotics are a specific kind of drugs, such as morphine. If no medication is required for your problem, maybe if you have a joint problem or a minor injury, you could be advised to rest or to wrap a bandage around the joint, to use an elastic bandage or other means of support. For minor injuries, you probably won't need to go and see a doctor. For example, you could have a small cut that doesn't require stitches. In this case, you would use a plaster to cover the wound. You might have twisted or sprained your ankle, in which case you would apply ice, a bandage, and take paracetamol or other painkillers. If the sprain is more serious, and if there is severe swelling or discoloration or bruising, you will phone the doctor and make an appointment, or even go to A&E in an ambulance. If the injury is more serious and you have broken a limb, for example your leg, you might need to have your limb put in plaster. Hopefully, you won't need any of these things and you will continue to be fit and healthy. If you do have the misfortune to become unwell or to be injured, then I hope that as soon as possible you are as right as rain.